Hello, my name is Rachel Murillo, and I am currently a postmaster's family nurse practitioner student at the University of Texas at El Paso. Today I would like to discuss with you the various methods of contraception. It is easy to become overwhelmed with the amount of choices available to you. My goal is to help you understand the basics of the various methods so you will be able to identify which method fits best with your current contraceptive needs. Throughout this presentation, I will explain how various contraceptive methods work. For you to be able to understand this, let's review some basic female anatomy. The normal female reproductive system consists of 2 ovaries, 2 fallopian tubes, the uterus, the cervix, and the vagina. Either the left or right ovary normally produce an egg once a month. The egg is released from the ovary into a fallopian tube and then travels to the uterus. There are various methods of contraception, but all work based on one of the following 2 principles. The agent may inhibit the development or the release of an egg, or it may block the male sperm and the female ova or egg from meeting. Many birth control methods use hormone-based medications. Some benefits of hormone-based methods include predictable shorter menstrual cycles, lower incidences of endometrial and ovarian cancer, decreased risk of PID or pelvic inflammatory disease, decreased risk of iron deficiency anemia. There are also some disadvantages, which include breakthrough bleeding, amenorrhea or absence of menses, risk of embolic events such as heart attacks, strokes, clot formation, feeling of bloating and weight gain, nausea, breast tenderness, fatigue, or headaches, and these methods do not protect against STDs. Due to the side effects, women over the age of 35, those who smoke or have a history of blood clots, pulmonary embolism, or cardiovascular disease are at a greater risk and are discouraged from the use of these methods. The pill remains the most common method of contraception. Women taking the pill will take it once daily at the same time to inhibit ovulation. The pill typically comes in a 28-day pack in which 21 pills are considered active, containing medication, and 7 pills are inert, containing no medication but act as reminders. Advantages include the ease of use and discontinuation, where disadvantages may be the need for daily medication and the increased likelihood of noncompliance, which decreases this method's overall effectiveness. In addition, there may be a higher likelihood of drug interactions taking the oral pill. The transdermal patch is yet another method of contraception. The transdermal patch is changed each week for 3 weeks, with 1 week of patch-free use. Advantages include the weekly application and fewer medication interactions, while disadvantages include that it may cause localized skin irritation, increased risk of thrombosis, and may not be as effective in patients who are obese. The vaginal ring is inserted monthly for 3 weeks and removed 1 week before placement of a new ring. Advantages include its convenient monthly application, decreased breakthrough bleeding, and fewer medication interactions, while disadvantages are that it increases the risk of vaginitis and may also cause headaches. DMPA is an intramuscular hormone injection which is taken once every 3 months. DMPA is also known by the name brand Depo-Provera. Advantages include that it's more effective than oral contraceptions, the patch, and the ring, and it can also be administered during breastfeeding. Disadvantages include that it decreases bone mineral density during administration, which is reversible after discontinuing the medication. It may also cause weight gain, and the FDA recommends careful consideration after 2 years of use due to the bone mineral density concerns. An implantable system is placed subcutaneously into the arm. The implant delivers a daily dose of hormones that inhibits ovulation. Implanon or Nexplanon are two types of implants. Their advantages include that they are extremely effective, often producing even greater results than sterilization, and the system may be left in place for up to 3 years. Disadvantages include that it requires an office visit for placement and removal, and it may cause irregular and unpredictable vaginal bleeding. Emergency contraception are oral tablets taken within 3 to 5 days of unprotected sex to prevent unwanted pregnancy. The advantages include that they are widely and easily available without prescription, and disadvantages are that nausea and vomiting are common side effects, and that it's not intended for routine use, but rather is used as a backup birth control method. Various barrier methods exist which serve to mechanically block the union of sperm and egg. Most methods inhibit the passage of sperm through the cervix. Barriers do not contain hormones and may appeal to individuals who cannot tolerate or prefer not to take hormonal birth control. In addition, condoms are the only method which provides protection against sexually transmitted diseases. Condoms are sheaths that are worn over an erect penis or within the vagina. These sheaths act as a mechanical barrier to sperm. Their advantages include that they protect against STDs, that they do not require prescription, and that they have a relatively low cost. Disadvantages include the reported reduced sensation during intercourse, and that it requires application immediately prior to intercourse. Spermicides are topical preparations that contain a chemical which kills sperm. Spermicides require application into the vagina over the cervix in order to be effective. There are various spermicidal preparations available, including film, gels, foams, creams, and suppositories. Advantages is that it does not require prescription and is generally low cost, and disadvantages include that there are no protection against STDs, and preparations may be messy and require application 10 to 30 minutes prior to intercourse. Diaphragms or cervical caps are latex-covered dome devices used in conjunction with a spermicide. The diaphragm is inserted vaginally and fits over the cervix. They require fitting by a healthcare professional to ensure proper size and protection. Advantages include that it may be inserted up to 6 to 8 hours before intercourse, and 6 to 8 hours after intercourse it may be left in place, not to exceed 24 hours. Disadvantages is its increased risk of UTIs, decreased effectiveness in women who have been pregnant, and that it requires individual fitting, which may change with significant weight changes, vaginal birth, or pelvic surgery. Intrauterine devices, or IUDs, are devices in which are implanted into the uterus. They are often placed in an office setting and can offer 5 to 10 years of contraception. In addition to their long periods of contraception, another advantage is that they can be used in breastfeeding women. Some disadvantages include the risk of pelvic inflammatory disease and ectopic pregnancy. Mirena is a device that can be left in place up to 5 years. It releases small amounts of a hormone which makes the uterine environment unfavorable for implantation. Paragard is a device that may be left up to 10 years, releasing small amounts of copper which act as a spermicide. The advantages include the long period of contraception, that they may be used in breastfeeding women, and with the use of Mirena, may have decrease in vaginal bleeding and painful menstruation. Disadvantages include the risk of pelvic infection and ectopic pregnancy. Fertility awareness methods, or natural family planning, revolves around the premise of understanding when ovulation occurs and fertility is at its highest. The couple will abstain from intercourse during this time to prevent pregnancy. Advantages are that there is no to low cost, and there are no risks related to medication side effects. Disadvantages is that it requires commitment from both partners and there is a high failure rate in comparison to other methods. There are 3 main methods used in fertility awareness, which include the calendar method, the basal body temperature method, and cervical mucus method. Using the calendar method, the woman charts her menstrual cycles for 6 months to determine cycle length. Based on the cycle length, the period of fertility begins by subtracting 18 days from the length of the shortest cycle and ends by subtracting 11 days from the length of the longest cycle. During this time, intercourse will be avoided. Basal body temperature is measured using basal thermometer. In this method, the woman will measure her temperature daily upon wakening, but before rising, and record in reading. An elevation of 0.5 to 1 degree Fahrenheit is consistent with ovulation. Abstaining from intercourse should be done from the end of menses until 3 days after the temperature increases. The cervical mucus method requires the woman to assess the characteristics of her cervical mucus daily and note the changes associated with ovulation. After menses, vaginal drying occurs, which then changes to thick, sticky mucus. The cervical mucus will then become clear, thin, and stretchy, resembling egg whites. The last peak day of wetness is associated with the greatest vaginal discharge of this character and coincides with ovulation. The fertile period is considered to be from the first sign of mucus to 4 days after the peak day. Now that you have seen the various methods of contraception, you are probably wondering which are the most effective. Effectiveness of methods is reported in 2 categories: typical use and perfect use. Typical use is how the average person will use the method, taking into account human error, such as forgotten pills. And perfect use is when the method is used correctly 100% of the time. Using this chart, you can see contraception effectiveness based on percentage of an unintended pregnancy within the first year of use. For example, the pill, patch, and ring with typical use is 8%, as with perfect use, it is 0.3%. Various methods carry various effectiveness percentages. Some of the highest effective methods include implants, where your lowest may be using spermicides alone. Choosing a method is a personal decision. Each woman must decide what method will best suit her sexual practices and beliefs. Now that you know what methods are available, you can ask your healthcare provider specific information about those methods and if they are right for you. Thank you for taking the time to become an educated consumer of healthcare. I look forward to talking to you individually about contraception.